Spectrum of Serenity. Continuing our exploration with the suicide. So we know what are the regions and how do we understand that whether someone is preparing himself or herself for suicide, right? So generally it is said, and even rather I must say that it has been proved in the studies that 11% of people experience passive ideation over their lifetime. The suicide ideation means when we observe the sign and symptoms that someone is going to or moving towards suicidal attempts, there is a deviation in their routine thoughts. Someone is thinking about suicide, someone is getting isolated, and there is a drastic change in the way they deal with the people, or drastic change in their mood and behavior, and they face a high level of angriness or aggressiveness or irritability, right? So these are some of the symptoms when we observe, no? So we need to learn how to cope up with those, all those things, right? So for understanding how to cope up with this, the first and very important thing is we just need to identify and recognize the trigger, that which is the main cause, which can be considered as a trigger, which deviating our thoughts or changing our thoughts, or which is uh, provoking our thoughts towards suicide, right? So first and foremost thing is we just need to understand the triggers, and then we also need to take care about the physical health. We need to take care about our body. We need to take full and proper care of our body. We need to treat our body in much better way, and then try to engage our thoughts and try to deviate our ideas towards the things in which we are interested. Means the things which are as per our interest and hobbies, we must indulge, we must engage, we must devote our time and effort as much as possible towards those activities which are as per our interest. And then we should uh, get engaged with the group activities. We should not be isolated, or we should not feel lonely. Rather, we must go to have a discussion with our friends. We must engage ourselves in some gathering in groups, and with the people who are matching, who have the same type of vibes, or who have positive vibes, who somewhere means in earlier they may be our friend circle or the family members who are near and dear ones. So it's always suggested to go and have engagement with the people, to go and engage with the people, rather than being isolated, and then allow time to relax. Take time to relax your body, take time to relax your mind. You may go for meditation, you may go for self exploration. So these are just small attempts we can do and we can have for overcoming with the suicidal ideation. Why we need to talk about this is because more than 80% adolescents who are indulged with the suicidal ideation, no, they try to communicate, and even they have communicated their idea before making any attempt for suicide. Yes, more than 80% people, more than 80% adolescent, they try to communicate their suicidal ideation before attempting. And then majority of youth who are the attempter, or who are the completer of suicide, no, they have seen their doctors at least prior to 3 months of their suicide. Prior to 3 months of attempt or committing the suicide, they have visited, and that has been proved in the studies. We need to use a comprehensive approach to prevent the suicide or to control the suicide ideation. For that, we can have the individual interventions, we can use the group psychotherapies, we can use the family psychotherapies, we can use individual interventions, we can use medication. So it is a complete package, we can say. A comprehensive approach must be used for preventing the suicides. The interventions or therapies, those interventions and therapies can be short term one, can be mid term, or can be the long term one, depending on the severity and depending on the intensity and depending on the risk level of the suicide attempts. So we can have the individual therapies, we can have the group psychotherapies, and the most popular one is CBT, that is cognitive behavioral therapy, in which we try to understand the cognitive behavior of people or the attempter of suicide. We try to manage that with the help of therapies. And even similarly, there is DBT, the dialect behavior therapy. So these are some of the popular therapies which are very much used to prevent the suicide intent ideation among people. So the easiest strategy to be used for suicide prevention is start asking questions. Yes, it is very much, and I must say it is very first step to find out whether a person is in danger of acting or maybe suffering some suicidal feelings or developing the suicidal ideation. So if you care for them, you must start asking questions. And what type of questions you may ask is that how are you coping with the current life status? Means you might have some idea that they are not feeling normal about their life, no? So you can start asking these type of questions. Do you ever feel like just giving up in your life, or are you thinking about hurting yourself, or you have ever thought about the suicide, um, or such feeling ever came into your mind, or have you thought of how do you do it, or how do you handle your current situation, or even you must explore and you must try to know that whether they have any um, excess of lethal weapons, like harmful weapons, like they might have some knife or even the pistol, or they might have some pesticides that can be used for attempting or for committing the suicides. So these are some general questions, and trust me, asking these questions won't provoke them to take the societal attempts. These will help you to start discussion at least, because having a conversation is the first and foremost step to handle the situation. And if you meet someone who recently have attempted for suicide, no, so you need to offer immediate help to them. And how can you do is, the first thing, never ever leave the person alone. Be with the person, be with the person, and try to contact the local emergency services as soon as possible. And if possible, just try to take that person to the emergency as soon as possible, and try to find out that if the person is under any influence of any type of substance abuses. These are the primary steps you can take if you meet a person who recently have attempted for the suicide, and you must ensure to convey to the family members about this incidents. And that is very much important, to convey the immediate relatives or kinship members or the family members about the incidents, and never ever promise with the person to keep this attempt secret. Yes, because the attempt for the suicide is very much crucial reason or factor for committing the suicide. So don't promise to keep this as a secret, and get help from the professional or trained expert.